Welcome to Pulse&Pressors, where critical care gets crystal clear. Sugammadex is a selective relaxant binding agent designed specifically to reverse aminosteroid neuromuscular blockers. It provides fast, predictable reversal by encapsulating Rocuronium and Vecuronium molecules. Because it does not interact with benzylosoquinolineiums, its use must be tailored to the paralytic administered. Sugammadex works by binding free Rocuronium or Vecuronium in the plasma, forming a tight, water-soluble complex. This removal of unbound drug from circulation creates a concentration gradient that draws drug molecules away from the neuromuscular junction. As acetylcholine receptors regain availability, neuromuscular transmission returns. Sugammadex has the strongest affinity for Rocuronium, moderate affinity for Vecuronium, and minimal to no effect on pancuronium's active metabolite. It cannot reverse Atracurium or Cisatracurium because they do not share the aminosteroid structure that allows encapsulation. Sugammadex is eliminated exclusively by the kidneys, with a half-life of approximately 2 hours. It undergoes minimal metabolism and has predictable linear kinetics. In renal failure, the drug accumulates, leading to prolonged circulation and unreliable reversal dynamics. The onset of reversal is rapid, often restoring train-of-4 responses within minutes. Reversal speed is dose-dependent, with deeper blockade requiring larger doses. Sugammadex works efficiently regardless of whether the blockade is moderate or profound. The standard dosing is 2 mg per kilogram for moderate blockade, 4 mg per kilogram for deep blockade, and 16 mg per kilogram for immediate rescue following high-dose Rocuronium RSI. Doses should be based on actual body weight and verified with train-of-4 monitoring. Sugammadex enables immediate reversal after rapid sequence intubation in situations where the airway cannot be secured. Administering 16 mg per kilogram reverses profound Rocuronium blockade, allowing spontaneous breathing to return and preventing the need for a surgical airway. After reversal, Sugammadex continues to circulate. If Rocuronium is redosed before Sugammadex clears, the drug will bind the new Rocuronium and prevent paralysis. This leads to an immediate failure of Re-Paralysis, a critical high-risk trap. To safely re-paralyze a patient, a benzylosoquinolineium, such as Cisatracurium, should be used, or the clinician must wait several hours for Sugammadex to clear before redosing Rocuronium. Attempting to re-paralyze prematurely with Rocuronium is unsafe and ineffective. Sugammadex is used in OR anesthesia for reversal of profound neuromuscular blockade, and as a rescue agent in failed airway situations. It avoids the bradycardia and cholinergic side effects associated with Neostigmine, providing cleaner and faster recovery. Contraindications include severe renal failure, hypersensitivity to cyclodextrins, and prior anaphylaxis to the medication. It should not be used solely for trivial residual blockade when simpler strategies are appropriate. Side effects include bradycardia, hypotension, rare but significant anaphylaxis, and potential rebound paralysis if the drug is misused. Sugammadex also temporarily reduces the effectiveness of hormonal contraceptives. Sugammadex interacts with hormonal medications, particularly oral contraceptives, and with Toremifene, which can delay recovery by competing for binding. It has no interaction with benzylosoquinolineium paralytics. In the ICU, prolonged circulation in renal failure makes its use unreliable. Because Rocuronium and Vecuronium redosing becomes unpredictable after reversal, Cisatracurium is preferred for ongoing paralysis, especially in ARDS, ECMO, or multi-organ failure. Compared to Neostigmine, Sugammadex provides faster, more reliable, and more complete reversal without cholinergic side effects. It is more expensive but offers superior performance and safety. Sugammadex is the modern standard for rapid neuromuscular reversal. Its unique binding mechanism makes it invaluable for anesthesia and airway rescue, but it requires careful planning for re-paralysis and should be avoided in severe renal failure. This is Pulse&Pressors, reflecting on the marvels of the human body. Subscribe to stay sharp.